Good morning and good afternoon to everybody from wherever you're joining us. Welcome to today's webinar, to Co-Creating Innovations with Alder Hey Children's Hospital, which is part of the NHS. I'm Anne McLaren, I'm with Yet2, and we're joined today by Emma Hughes, who's the Deputy Managing Director of Innovation at Alder Hey. So a little bit of housekeeping to begin with. We will be recording today's webinar, and that recording will be available to you once we've downloaded it and cleaned it up for you. As well as that, if you have any questions that come to mind during the webinar, please don't hesitate to submit them through the chat. We will definitely get to questions at the end, and we look forward to answering as many of those as possible. So a little bit about today's agenda. I will be introducing Yet2 for those of you who do not know who we are. That will just give you a little bit of context as to where we fit in the process. And then we'll be passing it over to Emma, who's going to talk about Alder Hey's open innovation strategy, their current technology need areas, and look at some case studies on partnering with Alder Hey and where they've seen some success. Then we'll be looking at tips for a successful submission before we move into a Q&A session. So as I said, please submit those questions through the chat and we'd be more than happy to get onto them. So to begin with, who is Yet2 and what do we do? Where do we fit in this process? So we're open innovation and technology scouting consultants. We've been in this business for over 20 years and we have offices here in Boston, Massachusetts, in the UK and in Japan. So our clients really benefit from our global reach and experience. We conduct both active scouting projects as well as hosting and managing open innovation portals like the Alder Hey Open Innovation Portal. We work to try and navigate and facilitate that partnership between solution providers, which are usually a smaller startup or research institution, with our clients who are often the Fortune 500s and Global 1000s of the world. So I'd like to talk a little bit about the Alder Hey Open Innovation Portal. This is one of our really interesting portals, and it's a great example of the flexibility of our open innovation portals and how we're able to cater for different applications. So this open innovation portal was launched in May 2020. And it was launched in response to the critical PPE shortage we experienced, in fact, the whole world experienced due to the COVID crisis. Emma's team came to us and needed a way to source new suppliers, ones that weren't yet known to them. They needed a way to gather those suppliers for as soon as they needed the PPE. So we were able to put together a portal for her. PPE suppliers were able to submit to the portal. They could submit their products. And over the following months, we were able to provide a list to Emma's team of PPE suppliers that would meet their needs. So as soon as the Alder Hey team needed those suppliers, they had access to all the details. Fortunately, later in 2020, the PPE supply gradually caught up with the demand, and we no longer had that need to seek new suppliers. So we're able to pivot the Alder Hey Open Innovation Portal to a more traditional type of portal, which is seeking new and innovative technologies for today's child, which with that, I'd like to pass it over to Emma. She's going to talk more about Alder Hey's Innovation Centre and how they're working to improve today's child. So pass it over to you, Emma. Thank you.
Lovely, thank you, Anne, and thank you, Yet2, for the opportunity to speak to everyone today. So just a bit of background, Alder Hey is a specialist children's hospital based in Liverpool, northwest of the UK, England. We are a leading children's hospital. We have now a digital enabled hospital that was newly built a couple of years ago. We've got a history of world firsts actually at Alder Hey. We were one of the first to perform cardiac surgery on children, the first neonatal unit, and there is rumours to believe we were also the first hospital to give penicillin to children, though that's not been confirmed. We've always been a very innovative and strong research-driven hospital, and we are now creating a real campus for advancing child health. So not just our innovation centre based here within the basement of the hospital, we have a leading research institute, but also we're building a campus where we can work with an ecosystem of companies and suppliers, all focused on how we improved today's child and improve actually to create tomorrow's healthier adult. This is where technology, we have. So as I said, we're very lucky. We have a very innovative and research-led organisation supported by our trust board and our executive team. And our innovation centre has actually been established for 5 years. We have got a co-creation space for working on real-world healthcare problems. We're a 1,000 square foot innovation hub, where we work with our clinicians, our patients, our operational teams in the hospitals, understanding where the real world challenges are that they're facing day to day. We then have implemented a kind of open innovation methodology where we'll really drill down into understanding the problem and then scout externally to find partners, SMEs, startups, who would like to co-create those solutions with us. We have quite a commercial focus, which is a little unusual for the NHS. We're really looking at understanding the value of the hospital knowledge, the clinical knowledge, in how you really fast track the R&D of new med tech. We really want to co-create with industry and understand that there's a real benefit that we're close, place-based innovation, you're close to the end users. And we really want to bring that innovation quickly and rapidly to the point of care. And so we have a team of up to 23 full-time equivalents. We're a real multidisciplinary team. Some of them traditional NHS, working in NHS for 20 plus years. We have clinicians, we have AI, data scientists, data engineers, we have innovation consultants, project managers, and more commercially orientated people, so that we really create this kind of multidisciplinary team that wraps around our wraps around the clinical and hospital teams on this co-creation and their problems. The ecosystem, as I said, is really critical to our success. We're not a large R&D centre, we're a hospital. We are really where the problems and the users are based. As I said, we've got the innovation team to wrap around that problem, help find those solutions. But finding those solutions from within an ecosystem is really important to us, that we're working with large corporates, with academia, with startups and SMEs. And that's really where the likes of the Yet2 have come in, and our portal is just one route to us finding those partners. And again, what we're bringing to those partners is really that user knowledge, that clinical knowledge to really fast track. We're very much focused on solving those real world problems and solving them quickly so we can have an impact. And during COVID actually was a real prime example about how fast we were able to co-create solutions, and some case studies later on around how we worked with the teams in developing new PPE, not only sourcing external PPE, but also creating new PPE. We are obviously based in the Liverpool City region. We want to not only have an effect on our patients within the hospital, but it's about how we really improve the health and well-being of the children in our region, but also nationally and internationally. We have global ambition that the work we do today, tackling those kind of inequalities, tackling child health, has global impact. Sadly in Liverpool, actually the life expectancy in a particular region of Liverpool is less than the life expectancy of children in Kenya. We're understanding that actually by a lot of the investment at the moment is going into aging well and not starting well. Also, a lot of investment tends to go to the south of the country, and that's got a massive effect on the economy in terms of not focusing on the pediatrics. So what we've tried to do is, really encourage and set up this ecosystem of focused on this child well-being. How do we improve and advance child health? And in the last 6 months, we've been working on our strategy around today's child, tomorrow's healthy adult. If we focus and can solve many of the inequalities and chronic conditions today, it's going to be hugely beneficial to the future future economy, but for the future health of our adults. And I say currently today, the paediatric market's not looked at as the most favourable with corporates, and a lot of the investment goes elsewhere. But we're really trying to change that mindset and championing with our partners to change that. Because also a lot of the technology we're developing is not just paediatric focus. We are all about, if we believe in terms of to achieve that tomorrow's healthier adult, it's got to become centered around the patient. We've got to become more preventative, preventing those diseases, being preemptive, enabling self-management. And to do that, there are a number of areas that we focus on at the moment. From a disease space perspective, obesity, respiratory, infection control, neuroscience are all areas we focus on. But in terms of technology platforms, and again, we're problem driven, but we also understand that there is new emerging technologies that are going to be really critical to us achieving the outcomes that we want. Part of that is working in AI and augmenting decision making, looking at kind of preemptive interventions that the algorithms are starting to help us predict. We are looking at digital therapeutic platforms, and I'll talk a little bit more about how that supports the remote monitoring, remote consultations. There's also the actual technology devices and sensing and wearables to actually manage the chronic conditions remotely. Again, working with teams looking at pediatric specific devices, because again, most of those, for example, in the asthma space, most of it's been developed with the adults in mind. To enable actually to treat children, they really have got to be immersed in their environment. They've got to be engaged. So we use a lot of immersive, interactive technologies, and we're really looking all about the child wow factor. So whilst Alder Hey might not be the next VR headset developer or the next new gaming company, what we can do is bring that child factor piece to it. Or if they've got a new inhaler, for example, how do you engage the child? So Alder Hey, when we're partnering and co-creating with the companies, they bring expertise which maybe in the technology and in the device, we're bringing the how do you actually utilize, engage that into the pediatric market. So just a couple of problems where, as I said, we're focused on specific disease state areas which we know are causing massive issues. So obesity, 20% of 6-year-olds are obese in the UK, and actually in Liverpool, that's 1 in 3 children. It also causes more lifelong conditions, and this is something I only really discovered recently, than any other condition. So in terms of impacting on musculoskeletal issues, cardiac issues, gastro challenges, but it's really hard to monitor those patients, to see what's going on, to engage with those children and young people in their own care. So it becomes quite a technical and logistical challenge actually, because every child's slightly different, because they may be obese, but they're also going to have multiple other chronic conditions. So we are looking for solutions that help us with that patient engagement, support that self-management, educate, prevent, as well as kind of feeding back some of that data to the clinicians and the teams to actually have an impactful intervention. We want to start early and intervene on this. And this is not just an Alder Hey challenge, we can't solve obesity ourselves, but there are some specific problems that we're working on. One with our obesity clinic in the hospital. Again, they've come to us specifically around how do we create a way to engage with the patient for them to feed back directly to the clinician their current weight, their exercise, their food, and the clinician to input and intervene at times when it's actually critical to that child. So there's a specific project there working with our clinic within the hospital. But as I said, it's much broader than that. It is really about how we support that self-management and prevention. Respiratory is another big area for us. 1 in 11 children are suffering with asthma, and it's a really challenging area for us in the Liverpool City region. There's many children coming into A&E with preventable asthma attacks, and the key point for that is actually they are preventable. They're not seeing and understanding the consequences of not taking their medicine. We've seen that they haven't had their 12-month checkup. and also the technology that's been developed to manage their asthma is very adult focused. Again, they're just not engaged. So we've been looking at a number of problems and solutions in the respiratory space. One being, again, using AI and data to understand the demographics of the children coming in to our A&E departments, understanding where do they live, who's their GP, you know, have they had their checkups, what medication they are, and starting to hone and pinpoint interventions to those places. And secondly, the other one is looking at wearables, not only, you know, doing kind of their lung capacity, their physical exercise, the environmental sensors, and how we bring all of that data together, again, to show when it's good for a child to go, it's safe for you to go and do your PE, or other times when actually, no, things are looking a little bit risky today, maybe you should take it easy. So we're really looking at the whole respiratory space, you know, not just beyond asthma as well, actually. One of the other challenges, as I've talked today, is, you know, more and more now is going to chronic condition management isn't within the hospital. It's got to be, it's about remote monitoring, it's remote consultations, and it's preventing these asthma attacks, and it's prevention. So, but one of the biggest challenges is many of these children have multiple chronic conditions. So they could have an app for their asthma, an app for their obesity. There's data coming in for different cases. And actually how you bring that together is always a challenge. How do you surface that data so that clinicians can make a decision and act and intervene looking at the holistic view of the child, versus just looking at their asthma condition or just looking at their ECG monitor. So we are looking at how we create platforms that are interoperable and bring multiple different devices, and the digital therapeutic space is a really strong interest area for us. You know, we would like to work with companies who have you know, different therapies, different digital ways of delivering therapy, support, prevention to our children and young people. And, you know, keeping children safe at home is quite critical, so that we do, you know, at the end of the day, there's also huge pressure on the hospital's capacity and running that. If we can keep them safe at home with this, you know, remote monitoring, it really takes the pressure off the hospital as well. So there are kind of three quite large areas of need, and we're really interested to hear about anything in those spaces that's a focus for us. Just a couple of case studies how we work. So this is a problem we had. We've got 13 different mental health service providers in the Liverpool and Sefton region, providing services to our children and young people, anything from eating disorder support, depression, anxiety. And for the children and young child to actually didn't understand how to access any of those services, it looked very disjointed, it felt confusing, didn't know how to get information for self-care. The waiting list was really long. You know, how do we intervene whilst they're waiting? So we worked with a number of partners. Mindwave, again, kind of SME local to us, looked at how did we set up a single platform where these children and young people, their parents, doctors, school teachers can all access to a single point of referral, and also access at the time of referral educational resources, therapeutic resources. So we created this, but we created this also in collaboration, as I said, with our SME partners, but in collaboration also with the clinical teams, the mental health workers, and also our chameleons, who are children and young people with mental health issues. So it's a really kind of user design thinking led program, as I said, multiple partners. And this is how we work in many of our projects, the co-creation. It's co-creation with the end users, access to these clinicians, it's looking at clinical pathways. So it's not just about, we have a technology, let's implement it. We actually look, well, what's the impact of implementing that technology? What changes do you need to make to the clinical pathway as well? It's a holistic approach, very much working closely with, as I said, clinical teams, patients, users, but well, our digital teams, our transformational teams. It involves a lot of different individuals in it. and this has just been launched, and we've had some great feedback so far. They're able to find their way to referrals. They also know where they are on the referral pathway as well. They know who they've been referred to, and we're going to be building out on this as our pilot in terms of being a remote monitoring platform. We're going to add digital therapeutics. We can look at patient reported outcomes, digital booking, and we think this is something we can really grow. As I said, the feedback so far from not only from the children and the parents, but also from the clinical teams, because it is also saving a huge amount of administration burden. Another very different example, again, problem was driven from our speech and language team. Mid-COVID last summer, they weren't able to treat those children and do their speech and language therapy. We also had a lot of kind of children, deaf children, and none of the current masks on the market were suitable. They're very, very tiny transparent windows, but also they were not medically safe. So we worked with the clinical teams on site. We did some scouting. Everything we found was not adequate. We then we prototyped it on site ourselves with our team. When we're talking about acetate and staples and sticky black plastic prototype, but once we'd got to a form that we felt looked quite interesting, we then worked with a product design company who again had 20 years experience in respirators, and we came up with more than a prototype, and we worked also with the regulators, because there wasn't an existing what's the word I'm looking for, grade for the medical device for this transparent mask. So we work with them, and what we've done now is we've licensed that mask to Blue Tree Group, who are in early stages of production of that mask. And the great thing about this is also that it's at the moment single use, but we are fast tracking multi-use version. So again, a really nice study of thing. We've taken it from a problem, iterated the prototyping, the product design with one partner. We've licensed it out to another partner, but it's all been done in less than a year. So I think that's the one thing that we're providing, I think, is being so close to the users and the clinical need. You're really able to fast track your R&D and bring solutions to our problems that actually are going to be relevant for that end user. With that in mind, I'll pass back, I think, to you, Anne.
Great, sorry about that, another tech issue, getting off mute. Thanks, Emma, really appreciate that. It's really most impressive to hear what's going on at the Innovation Centre and how you're able to develop some of these technologies. And I think it's interesting to hear how COVID-19 obviously has forced the acceleration of some of this development. So how can you help? How can our listeners help today? If you go to the Alder Hey innovation page, they have a list there of a lot of the technology areas, a lot of the areas that Emma was just speaking about. We have some specific technologies listed that Alder Hey is seeking. Having said that, as you heard Emma say, they have a need for many different types of technologies. So if your specific technology is not listed there, don't be concerned. They will also accept submissions against a general need. But some of the technologies that they're seeking are, novel eye drop administration techniques for pediatric ophthalmology. How can we administer eye drops to children and make it a pleasant experience so that they will want to come back? And then remote monitoring for pediatric epilepsy. That whole remote monitoring that technology is applicable over many industries. So can we find technology in an adjacent industry that can be adapted for pediatric epilepsy, for monitoring pediatric epilepsy? Just really important technologies there. So don't hesitate to go to the Alder Hey innovation page, which will list many of their needs. As I said, if you have a technology that's not specific to one of their needs, you can also go directly to alderhey.nhs.yet2.com page. That will take you to the Open Innovation portal, You can also access that from the Alder Hey innovation page. And if you can't remember all of those sites, you can simply go to yet2.com, and all of our portals are listed there as well. So feel free to submit your technology. We would love to hear from you, and we would love to assist Emma's team in moving forward with some of their needs. When you are submitting, these are just some tips for a successful submission. This is what we want to see. We really need to see a brief, non-confidential summary of your technology or product. It needs to be non-confidential. Unfortunately, if we receive confidential information, we do need to reject it and ask you to resubmit non-confidential information. We do need to see a comparative value proposition. Now, if you're not familiar with that term, it is what are the key benefits of your technology or product? How is it an improvement on the existing technology? And why would that be of interest to Alder Hey? In addition to that, we like to see efficacy data. Do you have any test or trial data that can substantiate your CVP? Sometimes this efficacy data is still confidential, so if that's the case, we don't want to see it. But if you can let us know, either send an abstract or let us know what you do have, so that we know what to expect once those confidentiality documents have been executed. Together with any intellectual property, it's always good to know if there are any patents or trademarks on your technology. We also have here a few things that we don't want to see. As I mentioned, we really don't want to see confidential information. Unfortunately, we do have to reject your submission if we do receive that, so please only send non-confidential information. We don't want to see a long submission with little content. You need to just make sure you put the points in that you need to get across, and also check any links or websites that you put in. We always check the links. We do click on everything that comes through to make sure we've got the total information. So if they're broken or invalid, it doesn't serve any good. And additionally, if you have any inquiries regarding careers, media, sponsorships or donations, it's best to use the Contact Us page on the Alder Hey site, and that can direct you to the most appropriate area. So with that being done, we'd love to move on to some questions now. Thank you, Emma, so much for your work and for the presentation. We do have a question here from somebody's. When you partner with a company, who owns the co-developed IP? How do you manage that process during partnering?
Start with the easy questions. So intellectual property, as you know, is a minefield. We are looking at, say, it's co-creation. We would at least first start looking at who's bringing what to the party. We generally start with kind of heads of terms around that, because again, in early innovation projects, you don't necessarily know what's going to be produced. There is not a single answer in terms of who then owns the co-created IP. It really depends on the level of development of what's being brought to the table in the first place. We have done deals where we have done a joint venture or joint equity, and the IP has gone into a JV. We've done others where the IP would sit with the commercial company in return for a royalty license to Alder Hey. And there's others where, if we have paid for the developments, the IP would sit with Alder Hey and we would provide license. So we're pretty flexible in our approach. I think the key thing to this is what we are trying to recognise here is that there's value in what Alder Hey and other NHS trusts bring in terms of clinical know-how, knowledge, the data, the patients, and we are looking for that to be recognised in some form, in terms of future revenues, royalties, or even if in some cases it is just we're going to do a med tech evaluation for you. So it does depend, let's say, the stage of development. We're pretty open. I think we find it probably hard when it's much more about companies wanting to sell to us, because if they're just trying to sell us product, that's probably not innovation. That will go to either a digital team or procurement. There really has to be something around this co-creation or enhancement. Or as I said, we will do evaluations, but it's generally on technology that hasn't previously been available to pediatrics or something like that.
Yeah, that makes sense. Emma, over the last 18 months, we've seen, particularly in the work that Yet Tooth's done, we've seen a lot of resources get diverted towards COVID-19. Just wondering, how has that affected your research and development work at Alder Hey?
There's probably two answers to that, because our research institute has kind of been impacted very differently in terms of certainly commercial research has been restricted. From an innovation perspective, actually, it has fast-tracked a number of things for us because they become absolutely critical. And also, we've been supporting the hospital and front line. The PPE, for example, the transparent masks, we also did other face coverings, has really increased the profile of innovation within the hospital as to how we can have direct impact on the front line and have that impact quite quickly. So it's really increased our engagement. It's also increased the number of projects that we're getting through. But also, for example, our mental health platform again became absolutely critical that project was not dropped. If anything, it had to be fast tracked, because we know as a result of COVID, there's a lot more mental health challenges for children and young people. So we absolutely wanted to be able to launch that platform quickly. So it's had actually had a very good impact on innovation. It's been very busy, very fast paced. But I think we've seen some things really go, like say, right the way through to going to be commercial products very quickly as a result.
That's good to hear. We just want to remind everybody, we've had a few questions come through. If you have any other questions, please don't hesitate to submit them. Another question, Emma, is do solutions that people submit need to be applicable to a healthcare facility, or can they be solutions that are used for outpatient care instead?
Absolutely, they can be applicable for anything. They might not even come from healthcare. You know, this is about transferring technology and knowledge, you know, whether it's in the automotive, logistics, into healthcare. We know, and this is why we use this open innovation methodology. We're not trying to recreate the wheel. You know, again, most of our programs of work now, it's not just about the challenges within the trust. We work, one of our most active divisions of innovation is the community teams. And as said, the platform approach, the Alder Hey Anywhere, we want to provide that equitable access to care wherever a child or young person is located. So it's centered around where they are, not necessarily about the hospital setting.
That makes sense. Emma, we know how busy you are, but we know that the staff in hospital are even busier. We see that on the news, we see that through the media. How do you find creative ways to involve them to seek out collaborative innovation?
So there's a number of ways. We have a very proactive engagement program, and clearly actually during COVID that wasn't quite as active in terms of in person. We run a number of workshops and open days, but innovation is open to anyone within the hospital. So we have a digital form where anyone could submit their problems and challenges. Now, recognising they all have day jobs and very critical, we have a team in the Innovation Centre of 23 people, and we wrap around those clinical and operational teams. So once they put forward their idea, their problem, we'll do a lot of that legwork for them in terms of really digging into the scale problems, scouting solutions. Yes, we do need them to be involved in terms of that direct access for, you know, validating solutions, but generally, you know, if the problem's big enough for them, such as our speech and language team, were absolutely engaged, and it was brilliant, you know, because we're bringing solutions that are going to have impact on their day-to-day work and impact on the care, and therefore, you know, we've got some really greatly motivated staff in Alder Hey for innovation.
Yeah, that's good to hear. We all owe a great deal of gratitude to your colleagues. The fact that they're able to look after us as well as dedicate time to collaborative ways for innovation is quite incredible. I know there's a lot of concern with people about the stage of technology that you're looking at for submissions. Can you talk to what sort of technology stages? Does it need to be a fully developed solution, How do you approach the different stages of technology at Alder Hey?
Actually fully developed and ready to sell is probably not of interest, if I'm honest. We want something that, we haven't got, well, there's medical devices, we have to go through MHRA and everything else, that we're not going to change that. But in terms of the technology, what we're looking to do is really hone solutions that fit our problems. And, how can we develop existing technology but have it applicable for the pediatric space, or say some of the data work we're doing is going to have applicability in whatever age range. So no, I wouldn't say it has to be fully developed. It could be a capability. We work with a lot of really innovative digital user experience gamification companies, and they will look at alternative ways to engage with us and applications just for Alder Hey. I think it's hard for us. It's really vapor stage, and there isn't the research to back up its efficacy as a base technology. That's always a challenge. So it needs to have some proof of concept data around it. But having said that, we are also groundbreaking in some areas, such as looking at that AI and how we utilize AI in different applications, looking at kind of the space of genomics, and there's lots of future tech that we are looking at. It's just not something we'll be able to implement anytime soon.
Yeah, get it. Similar to that, we have concerns we often get asked from our submitters about the process or the length of time it takes for development and for submissions to be processed, and what can they expect. And I'm happy to speak on behalf of Yet 2 for this, that certainly when Yet 2 receives a submission to the Alder Hey portal, it's always looked at within a couple of days. If it's not that day, it will be the next day. So any submitter that submits to the portal should expect to receive a communication from Yet 2 within a couple of days. That communication may be for more information. It may be that the submission is not suitable, or it may be that the submission is going through to Alder Hey. So once we forward a submission through to you, Emma, can you talk to the process of the types of the time that people can expect? I know you said that the clear mask was developed rapidly, and we understand the needs for that. That typical development time, or can you give an idea of what submitters can expect?
Yeah, I think the clear mask is quite an unusual case in terms of the speed of that, but just in terms of reassurance and feedback. So we have, again, our internal process. So we have a weekly triage meeting. So any new submissions, solutions, problems that come in from the hospital or externally are looked at on a weekly basis. They may, if it's a new solution, will be looked at, is it against an existing problem? Is it one that's a very specific problem, or is it one in more generically, for example, gamification UX, in which case it would then be passed to our innovation consultant project lead to review in relation to their project, and they would look at that submission. So generally they'd made contact within a week, within 2 weeks, and again from there there'll be initial conversations, and from there explore what the opportunities are. I said it does vary depending on whether it's a currently active project or whether it's just a problem that we are still validating. So we have our triage session, we have a validation period that can actually be a couple of months, because we're doing all of our scouting, due diligence, around problems and solutions. So that could be a couple of months, but during that time then we would engage with those submitters, and then we have to look at funding streams to then become active projects. But again, whoever we're engaging with is usually communicated well on that side of things.
Now, Emma, I know you have a really interesting background. You haven't been in the healthcare industry for your entire career. Can you comment on the difference between innovation in the healthcare industry as opposed to healthcare or innovation in the corporate world?
Yes, interesting. So yes, 20 odd years in open innovation across multiple industries. And it's actually very, very similar in terms of starting 20 years ago when large corporates were looking at how do we solve, well, actually they wanted to sell technology, but then it moved into how do we solve problems, how do we create more of an innovative culture, how do we engage people. That's exactly the same thing that is needed, and we're starting within the NHS. It's really about the culture, the people, engaging everybody in innovation and not just being one person's job and a separate department. So actually the things and the journey we're going through, building this innovation centre and building the capabilities within Alder Hey, it's very similar to the early days of when it's starting up innovation in large corporates. Again, it's really helpful to have senior stakeholders. We're really lucky in Alder Hey, the support we get from our trust board and our execs and CEO, and that's the same in large corporates. Because as I said, innovation has to be embedded. It's exactly the same as where we have shifted in the last couple of years from, a little bit more ad hoc in terms of the things we worked on, and there was lots of enthusiasm for innovation. We've shifted now to actually making sure the innovation strategy is part of the trust strategy, and the problem and areas we focus on are aligned with that strategy of the trust. And again, that's exactly what we saw in the corporates. It can't be a separate, not aligned, a separate kind of business. There's also, you do need to make the space for that serendipity, blue sky type of work as well. So I see a huge amount of similarities.
That's great to hear. Emma, it's been a fascinating discussion with you today. We thank you very much for your time. Thank all our listeners for joining us today. We really appreciate your time that you're taking out of the day. If you have any further questions, feel free to reach out to me at Yat2. We can always put you in contact with Emma. We can facilitate introductions. Please submit your technology to the Open Innovation Portal. It will come to us, but we make sure it gets to the right people at Alder Hey, and we look forward to helping you move forward with your innovation program. Thank you so much for your time, and I wish all our listeners and you, Emma, a great rest of your day.
Thank you very much. It's been a pleasure. Thanks. Bye-bye.